Hello and welcome to 6 Minutes. I'm Gemma Collins. Australia's largest study of blood pressure levels in general practice has been released today, showing that hypertension is undertreated. The study of more than 500,000 patients found that a high proportion are recording a blood pressure level above their recommended targets, and some of these patients are not even receiving treatment. We spoke to one of the authors of the study, Professor Simon Stewart, Head of Preventative Health at Baker IDI, to find out more about it.
It tells us a couple of things. The first thing, that hypertension is still around. It still remains at historically high levels. So around 1 in 3 patients are walking through the door with elevated blood pressure. It also tells us that the antihypertensive treatments do work when people are treated, but they're not getting to their key targets. And so what you are seeing is an effect after the first visit of the treatment, but then it plateaus out. So we're not working hard enough. That's the healthcare team and the patients to drive those blood pressures down to target levels. We know they're hard to achieve, but it's well worth the effort of doing so. And we know that as first-line therapy, most of the class of agents do work. So ACE inhibitors, the angiotensin receptor blockers, or a low-dose thiazide diuretic, for example, trying that. But be prepared, if necessary, to try combination therapy, typically either with an ACE inhibitor or an ARB together with a calcium antagonist, or in some cases a diuretic to achieve a lower target. So the key message really is profile your patients to determine if they're a high risk. If they are at high risk, then work with those patients to drive their blood pressures down. For example, if you have cardiovascular disease or diabetes, you should be trying to get your patient down to the 130 on 80 target, but that will probably take a few appointments and maybe a preparedness to go to combination and perhaps triple therapy if required. So the guidelines have probably muddied the water in recent years because they've introduced different levels of targets for patients, from the historical 140 on 90 to lower targets that in actual fact may be a bridge too far. There is some evidence, for example, that trying to achieve a level of 125 on 75 is too low and very difficult in a naturally hypertensive patient. But on the other hand, the guidelines and the evidence are clear that we should be trying to achieve lower blood pressure in our patients. And if you are prepared to be more aggressive and more attentive in your management of the patient, that is applying combination and triple therapy, that will provide benefits for the patient, because the lower you go, the better. So one way of really truly determining whether or not your patient's hypertensive is with ambulatory blood pressure monitoring, the 24-hour blood pressure monitors. The other alternative, of course, is ask your patient to take home a monitor if they have one available to them, and to record it in diaries.
Well, if you're wanting to read more about the study, you can find it on the Baker IDI website. I'm Gemma Collins. See you next week.